Hi class, my name is Haley Plunkett and I'm going to be doing my abnormal psychology topic presentation on schizophrenia. To start, we're going to go ahead and go over some definitions I think are important to know before we get any further into the topic of schizophrenia. All the definitions on this slide were obtained from Merriam-Webster. So let's go ahead and look at the definition of schizophrenia. I'm going to give you guys the definition from our Psych 2320 class rather than the Merriam-Webster definition, which is a disorder marked by positive symptoms such as delusions, negative symptoms, and disorganized behavior. So, what are delusions and hallucinations? First of all, a delusion is a belief that contradicts reality and remains unshakable despite evidence it's not. So, those suffering from schizophrenia might be dealing with delusions. An example of one of these delusions could be that they're dating a celebrity, or perhaps God is coming back to Earth to come and save everybody. So, to a normal, able bodied person, these might seem ridiculous, and we can use common sense to justify that's simply not the truth and that's not going to happen. But even if you identify these things and show the sufferer of this delusion evidence, they're still not going to believe it. They're very hard strung in this belief and this delusion. As for hallucinations, we can identify this as a sensory perception that occurs in the absence of an actual external stimulus. So when we think about a hallucination, we generally think of someone seeing something that's not there, but this does not just stop at seeing something. This could be hearing something, feeling something, smelling something that's not actually there. So a person suffering from a hallucination has the sensory perception in their mind. They're seeing something or they're smelling something, and their receptors are going off and telling them that, hey, I'm seeing this, or I'm smelling this, or I'm feeling this, but there's actually not an external stimulus like actual food that they'd be smelling or someone that's actually in the room while they're suffering these hallucinations. Now that we've gone over some of the major definitions, we can get into some of the other ones. Apathy is a lack of feeling or emotion. This could be a symptom of schizophrenia. Psychosis. Psychosis is pretty much a state where the sufferer has lost contact with reality, and they're suffering many delusions and hallucinations, and they pretty much just don't know what's real or fake. And then we have prodrome and cognitive impairment. Cognitive impairment is the decline in one or more mental abilities. What are the causes of schizophrenia? So researchers don't yet entirely have a definitive answer on what causes schizophrenia, but they found a few factors that might play into the development of schizophrenia. And they've actually found over time that it's not generally someone suffering just one of these factors. It's generally all of these factors playing a part in the development of schizophrenia. So one of these factors is genetics, and generally when we think of something that we're predispositioned to, whether it be a disorder or disease, we think of a gene that's being passed down that we can obtain, but research actually suggests that it's a combination of multiple genetic variants that is causing the development of schizophrenia later on in life. Another one of these factors which research suggests might play a role in the development of schizophrenia is environmental factors. Some of these factors being prenatal complications, which could be malnutrition in utero, or stress and trauma generally endured while you're a child. The last factor that research has identified as a possible cause for the development of schizophrenia is neurobiological changes. Researchers have found that folks suffering from schizophrenia generally have a dysfunction in their glutamate system, along with excessive dopamine activity going on in their brain. So these imbalances in the brain chemistry are a very probable cause as to why folks might be developing schizophrenia. So schizophrenia has phases, and the first phase is the prodromal phase. This is basically the onset of this disorder. This phase shows is minor personality and behavioral changes, and the symptoms aren't generally recognized until you're into the next phase. So going into the next phase, we have the psychotic prephase. And this is when the first main symptoms of this disorder show. It generally presents as hallucinations to start. And this is a big indicator that you're about to go into the active phase and that you're about to have most likely really severe symptoms of schizophrenia. So the active phase is going to be basically the peak of schizophrenia. These are going to be when your symptoms are the most severe, you're suffering from the most symptoms. They're going to be concurrent. And this is going to be a really crippling time period for someone with this disorder. And cognitively, they are going to be impaired in very many different ways. The residual phase, this is basically the phase that is the letdown of the active phase. Symptoms are going to subside. They might not completely disappear, but they're going to lessen, along with there still will be some residual effects from the active phase, like certain impairments or trouble with speaking or trouble with behaviors. But usually the hallucinations and the delusions will calm down, and eventually this person will go back into their everyday life. Let's go ahead and go over the different types of schizophrenia and some of their characteristics. The first disorder we're going to go over is schizotypal personality disorder. Generally, someone with this disorder is going to present as a very suspicious person. They're very suspicious of the things and people around them. They have very bizarre and eccentric behaviors, and they also suffer with excessive social anxiety. So making relationships is very hard for them. Their inner circles are generally very, very small. And then they don't typically suffer from delusions or hallucinations like other schizophrenic disorders might. Delusional disorder presents with delusions that are actually very probable and not very bizarre, but they happen in a high quantity. We also find that there is no disorganized thoughts or hallucinations presenting in delusional disorder. Moving on to brief psychotic disorder. This disorder does not impact everyday life, but instead brief periods when these episodes are brought on, generally 1 day to 1 month. Anything over that would be considered a different disorder. These episodes are triggered by stress, and the person might suffer from delusions, hallucination, disordered thinking, and or disordered behavior during these episodes. Once the episode is over, this person will return back to their normal everyday function. Now with schizophreniform disorder, we're going to see pretty much the same symptoms that you would see in brief psychotic disorder, except these symptoms are going to last between 1 month and 6 months. Anything over that would be a different disorder, and anything other than that would most likely be considered brief psychotic disorder, but they're going to be suffering the same symptoms. As for schizoaffective disorder, this disorder is going to present not only with schizophrenia symptoms, but also with depressive symptoms and bipolar symptoms. So we're going to see mania, depression, and then we're also going to see hallucinations and delusions. And this is a chronic disorder that impacts everyday function. Let's go ahead and look at DSM-5 criteria for schizophrenia. And what this is basically a checklist that a healthcare professional will have to go through with a patient to be able to diagnose them with this disorder. So to start, the patient is going to have to be experiencing 2 or more of the main symptoms. You can view the main symptoms of schizophrenia to the right. And then not only that, but at least one of those 2 or more symptoms that are identified have to be delusions, hallucinations, or disorganized speech to be considered for a schizophrenia diagnosis. Moving on down the list, we can see that symptoms have to be presenting for a significant amount of time within a 1 month period. So these symptoms have to be consistent and reoccurring, along with the disturbance cannot be attributed to another medical condition or substance use. So the patient cannot have a different medical condition that these symptoms could be attributed to, or be using a substance that might be causing them these symptoms. Along with if there is history of ASD or communication disorder, the additional diagnosis is only made if the hallucinations and delusions are prominent. And then to end it off, schizoaffective disorder, bipolar, or depressive disorder with psychotic features has been ruled out. So basically, the healthcare provider has double checked that the patient is not suffering with one of these disorders before they make a schizophrenia diagnosis. What are some assumptions made which contribute to the schizophrenia stigma? So automatically, I think the first assumption that a lot of people make is that people with schizophrenia are crazy because they have these hallucinations and delusions. And then I think that the media also portrays that, which kind of blows it out of proportion and puts this idea that people with schizophrenia are crazy into everybody's mind, which is not true. Some other stigmas that we see are people with schizophrenia are on drugs, they're unpredictable and violent, or they're even psychopaths. Which for some, this might be true. Some of them might be using drugs, some of them might be violent, some of them might even have, a psychotic disorder on top of their schizophrenia diagnosis. But that does not mean it's true for the entire community, and that does not mean that these are things that folks with this disorder generally do. Overall, all these stigmas are bad and they're harmful. They place a cloud around people with this disorder who can't even control it, and they're just simply trying to go about their day. Not only that, but they place a very harmful view on them and make them seem like they're violent or they're delusional or they're all of these things when really they're not, and they're only suffering from these symptoms in brief episodes. Ultimately, breaking down these stigmas would be ideal as they're harmful and impactful to those actually suffering from the disorder. These stigmas could be the reason someone's not seeking treatment, or someone's not speaking out, or someone's not educated enough to get a diagnosis. Let's move on to treatment for schizophrenia. So, although this disorder isn't curable, there are treatment methods to make it more bearable and to increase the quality of life that someone suffering with this disorder might be experiencing. So, the first course of action that doctors usually take is prescribing medication to help manage and treat this disorder, and then suggesting them go to therapy. Usually, they'll suggest CBT, which is cognitive behavioral therapy. And then some other things that the person suffering from this disorder can do on their own is seek support groups and connect with individuals who are also suffering with schizophrenia and who can relate to them and might understand what they're going through and why they're acting the way that they are, along with self-management, since this is generally a chronic disorder, making sure that the individual takes their medications on time and they're utilizing coping mechanisms and they're actively going to therapy is a great way for them to stay on track and continue their treatment. This is my bibliography with the references and sources that I used throughout this presentation. This is my accreditation to SlidesGo, which is the website that I took this presentation template off of.